So in my last video, I talked about how tariffs can affect healthcare and an example of a cost burden that can be put onto hospitals and importers for importing the same things that we use every day. So check out that video to see the math. In this video, I'm just going to talk about how tariffs can lead to a burden on the system in different areas, and not necessarily just the cost burden. So of course there's a cost for hospitals and clinics. You're paying more to use supplies that you've been using every day, the supplies that we need. And so it's just a higher cost there. There's also cost to patients because now insurance companies have to pay more to hospitals and clinics to cover the cost of supplies, the cost of patient care, and that cost has to come from somewhere, right? And so patients may see higher premiums, may see higher out-of-pocket costs, or things, higher service fees, or things just may not be covered anymore. There's also supply chain disruptions. So if there's tariffs that are increasing on one country that we rely on for certain equipment, it makes sense that many importers are going to look for other sources of those same supplies from a country that maybe doesn't have tariffs or doesn't have the increased tariffs or it's not so high or whatever. However, to make that switch and to put in those purchase orders and then to get the equipment you need, it takes time. So then you might see supply chain disruptions. There's also an impact on innovation. If equipment for research, for example, is more expensive, it will become harder to source, harder to bring into the country, which means there's delays in bringing it over potentially, or you just are priced out and you can't purchase it anymore. And so that affects research, that affects innovation, that affects finding proper treatments for patients, from everything related to pharmaceuticals to just like developing protocols for clinical research. Everything can be affected. And then small business and healthcare providers who are maybe independent, the out-of-pocket cost for them will be exponentially higher and much more harder for them to offset into other areas in their business, whereas a big hospital or big hospital system has deeper pockets and can maybe cover some of these extra costs without passing them on to patients or passing them on to providers and so on. And so smaller providers may go out of business, which can greatly affect smaller communities, rural communities, and being absorbed into a bigger healthcare system, for example, if you get bought out, isn't always a good thing. And so these are just things to watch out for depending on how the winds go with all the tariff news out there, just things to consider in terms of how healthcare is affected. And as of today, let me know if I'm wrong, but as of today, I have not heard about exceptions to healthcare, but that is one way around this whole mess. So we'll see what happens. Like and follow for additional information on healthcare and health tech.